Welcome, everyone. Good afternoon. We're starting a new series called Doc Talk, and this is presented by Torrance Memorial Medical Center and specifically Torrance Memorial IPA, which is an independent practice association owned by Torrance Memorial Medical Center. This does senior work, and I am the chairman of the Physician Advisory Committee and also co-manager of lectures and education for our community. So we came up with the idea of Doc Talk, and the first one that we're going to do is microbiome, the microbiome system. This is a fascinating subject, and we're going to talk about how it shapes us and how it shapes and fits into the world. So our first slide is interesting in that more than a century ago, if you could read this with me, the dependence of the intestinal microbes, that's your bacteria in your intestinal tract, on food makes it possible to adopt measures to modify the flora. The flora is what makes up our bodies, and replace the harmful microbes by useful microbes. So more than a century ago, this genius, Dr. Menchikoff, in 1907, was the first to really understand that the intestinal microbes could have widespread effect on the human body. So what is this microbiome? That's the community of organisms that share our body. They share our body space. And you could see that guy laying there saying, welcome to the gut, population 100 trillion. So there are 100 trillion microbes in our body, and they outnumber human cells 1 to 1 to 1. So there are more microbiome cells than there are human cells. And as you know, we have 23,000 genes, and every day another gene is identified. And we're working now, the oncologists, with gene therapy in cancer research, something called CRISPR, which I hope I can talk about in a couple of months when we do this again. So if we have 23,000 genes, the bacteria have 8 million genes, much more complex. Next slide, please. So let's look evolutionary at the time-wise. Mammals were around about 200 million years ago. Then the primates came over 60 million years ago. And then us, we're Homo sapiens, humans. We came about 2.5 million years ago. So we're like the new kids on the block at 2.5 million years. But the intestinal microbes have been tracked back 3.5 billion years. So that bacteria has been crawling around and has been present on Earth for 3.5 billion years. An amazing concept. So these microbiomes are very dominant, and I want to show you how they fit in to our diseases and our lives. And I'll start with the fact that the GI tract, that's the esophagus, the stomach, the intestine, the colon, has no bacteria at birth, zero. It is totally sterile. But within 3 hours, the bacteria somehow get into our bodies and colonize. They colonize the GI tract. And by a month, the total microbiome flora, the population of microbes, are present within 3 to 4 weeks. By 3 to 4 weeks, that's it. You got your set of bacteria in your body. There are more than 1,000 species of microbes that inhabit your body. Incredible. So what does it weigh? These bacteria weigh 3 pounds. So this is good news for us. If we're overweight at 188 pounds, we're really only 185 pounds because the bacteria make up 3 pounds. It's a 3-pound weight. Can you imagine? It's 3 pounds, these bacteria. So what shapes it? What causes it? What makes it bloom? The delivery of a child is critical. If it's a vaginal delivery versus a C-section, I'll get into that a little later, but there's a tremendous difference in the bacteria vaginally or C-section. I'll give you a hint. A vaginal delivery is better from a microbial standpoint. What else shapes our microbiome? Antibiotics. They can knock them off. They can knock off the good. Sometimes they leave the bad, and we'll get into that. Probiotics. You go to the drugstore, there are 1 billion probiotics for sale. I forgot, we have a later slide. It shows you how many billions of dollars are spent on probiotics for supposed health. Where we live, our travel, our diet, whether we exercise, whether we take Nexium or Zantac to knock out the acid in our stomach so that they can thrive more, and malnutrition. Next slide, please. So I'm going to get into some studies showing how the microbiome affects your weight. If you take some mice, as well as humans, the gut bacteria differ in composition between heavy, obese, and lean subjects. So that means if you culture the stool, there'll be a difference in the microbiomes between heavy people and thin people. And the difference is in the ratio of 2 bacteria. One is Bacteroides, and the other is Fumicutis. And when there's a decrease in Bacteroides and an increase in Fumicutis, you are going to be heavy. You got that? So we culture the stool, we look at the bacteria, and we can tell who's heavy and who's lean. And I'm going to get into that a little bit more, because that's where most of the research now is coming from on the microbiome. So we all know what bariatric surgery is. We know that that's surgery for people who are very, very heavy. And it could be a gastric bypass, or they can sew the linings of the stomach closed. But most of the time they do these gastric bypass surgeries. So the bacteria in the stool is different in patients after gastric bypass surgery compared to controls who are heavy. Mm-hmm. And the bacteria are E. coli, Klebsiella, Pseudomonas. They're all more common in the bariatric surgery patient. So listen carefully now. Stool from a gastric bypass patient, right? Patient has had bypass surgery, and you transfer that to a sterile mouse. The mouse then has improved fat oxidation, and microbes transplanted, they will have a 43% less body fat compared to mice that received stool from standard stomach surgery. So again, if you take that stool from a bypass patient, put it into some mice who are sterile, when they start to grow, they're going to be really, really skinny. I don't think anybody truly has an explanation for that, but it's an incredible observation. So here's a study in a woman, 32-year-old woman who has chronic C. diff. Now, CD means C. difficile. This is a horrible disease. This is when your colon totally ulcerates, and it's usually due to too much antibiotics. The antibiotics knock out the good bacteria, leaving C. difficile, the bad bacteria. And there are many medical treatments for this. Sometimes we use a drug called Flagyl, and I'll show you some other ways that we can treat it. But this woman got the most up-to-date treatment, and it's called a fecal transplant. What they did was they took healthy stool from her 16-year-old daughter, and they put it in an enema bag, and they put healthy stool into this woman's colon, and she made a complete recovery. So we do that. I'm a retired gastroenterologist, and what we would do would get a healthy human relative, and we would inject, we would put in our forceps into the colon, and then put the stool, the healthy stool, into the small intestine and let it drip down into the colon. So this woman was 136 pounds. She had a normal BMI, basal metabolic rate. She received the fecal transplant from her daughter, who weighed 140 pounds, who blossomed to 170 pounds. She was probably happy. But 36 months later, after the fecal transplant, the patient weighed 177 pounds. So the stool from her daughter had something in it that made her gain weight. I hope you're following me. I think it's pretty clear. Next slide, please. So what is a frozen poopsicle? Well, over at Harvard, they took stool from healthy people. So they didn't have hepatitis, they didn't have ulcerative colitis. These were healthy people, and they put them in capsules. And then they treated 14 of 20 patients with C. difficile diarrhea. So they took the capsule, they whiffed it down with some water. 4 out of 6 did not respond, but on retreatment, they responded. So they all responded to healthy stool going into their colon. And you could see the reference from the Journal of the American Medical Association. Next slide, please. So OpenBiome is the name of the nonprofit stool bank at Harvard. They rigorously test stool preparations, and they send them out to hospitals. And right now, as of 2017, probably more, they've sent it out to over 1,000 hospitals. So the hospitals can say, send us 20, 30, 40 of your capsules, and they'll ship them to the hospitals to take this. Remember, C. difficile has about a 25% mortality. And I took care of a lot of patients with C. difficile when I was in practice. And I would say about 10% of them had to have their colon removed. And they wound up with an ileostomy because this disease was so severe. We didn't know about this. I'll give you a little funny insight. When I was an intern in 1968, we had a genius attending doctor, and we had patients with profound watery diarrhea after antibiotics. We didn't know at that time that it was caused by C. difficile. And in 1968, we were giving fecal enemas to these patients. 1968. So then 78, 98, 208, 35, 40 years later, they decided to do this again. Incredible.
I think there's only 4 people on this.
Next slide, please. So this isn't a slide showing the long-term infant outcomes by mode of delivery. Remember I told you that vaginal was better than cesarean. So children born of cesarean sections are more likely to develop type 1 diabetes, that's insulin dependent, celiac disease, which is gluten sensitivity, hospitalizations for gastroenteritis, asthma, and allergic rhinitis. That's been shown in children who are born to C-section. I mean, C-sections probably make up 15 to 20% of deliveries. Now, it has to be done. Sometimes it's an emergency. Next slide, please. So there's been a sharp rise in C-section in recent years. You know, in Italy, 100% of the children are born by C-section. And I found this out when I was touring the hospitals of Italy. And the reason for that is in Italy, malpractice is not civil. You don't go to civil court, you go to criminal court. So they didn't want to go to jail if they had a bad baby. And you have a much higher chance of getting a bad baby with a vaginal delivery. So in Italy, all the babies are C-section. Here in the United States, 15% is acceptable. And as I said, there's an increase in asthma, allergies, eczema, obesity. And the question is microbiome to blame? In addition to different microbiomes with C-section, other factors may play a role. But the mothers who get C-sections, they get antibiotics. They have a greater prevalence of being heavy. They have a lower rates of breastfeeding. So the FDA has approved studies on C-section versus vaginal delivery. Next slide, please. Let's move on to a different system. Let's move on to the brain. How on earth can these bacteria in your intestine affect your brain? Well, they do, because the immune system is active in myelin destruction. Myelin is what coats your nerve endings. And if you alter the gut bacteria in mice, you could lead to a multiple sclerosis-like disease called experimental autoimmune encephalomyelitis, EAE. And preliminary work shows that the gut and its bacteria in MS patients contain bugs that drive inflammation and are low in the types of bacteria that control inflammation. So there could be a role of gut bacteria in multiple sclerosis and other autoimmune diseases of the brain and spinal cord. So a minor conclusion here is that the gut microbiome profile is probably associated with brain microstructure and function. So let's move on to other conditions. Can microbes affect stroke? You say, how on earth can intestinal microbes affect a stroke? Well, here's a study. They had 2 colonies of mice. Group 1 was bacteria resistant to antibiotics. Group 2 were bacteria that were sensitive to antibiotics. And then they clotted off the carotid arteries of the mice. You know, that's like a stroke. People flip off, in human beings, a piece of plaque, or they get a plaque in their coronary arteries. Well, the brain damage was significantly smaller in the gut bacteria that was vulnerable to antibiotics. Think about that for a concept. Stroke. This is about heart disease. I'm going to define TMAO, microbiomes, coronary artery disease, and stroke. There's a substance called TMAO, trimethylamine N-oxide. And this is produced when the bacteria digest nutrient lecithin. And if you give human subjects 2 hard-boiled eggs and a capsule of lecithin, their MAAO will go up. However, when subjects are given broad-spectrum antibiotics, their TMAO was suppressed. High TMAO blood levels are associated with a higher risk of heart disease or stroke, independent of other risk factors like lipids and obesity and exercise. A very interesting study. Next slide, please. So popular diets have different effects on TMAO. That's the bad guy. A high-fat diet for 4 weeks, you got a high TMAO. And a low-fat, the famous Ornish diet for 4 weeks, was associated with low levels of TMAO. That was a low-fat diet. So diet is destiny. Perhaps your fate is determined by the genome in your body and how it is affected by the microbiomes. Now, is this person trying to lose weight? There's a double cheese, French fries, their desserts. What are their desserts?
Apple pies.
Apple pies, they look great. But again, they had a Diet Coke for 1 calorie. So I don't think they're trying to lose that much weight. That's a lot of calories. So let's talk about pre and probiotics. Envision the prebiotics as the fertilizer, the fertilization that goes into your intestinal tract. It doesn't really confer that much health benefits. But then the probiotic, which is ingested afterwards, that's associated with major health benefits. So the prebiotics are these selectively fermented products. Kombucha, I think, is one, and kimchi is a prebiotic. So prebiotics you want to take, and then you want to follow that with probiotics. And I favor the probiotics that are in the freezer, that are in the refrigerator. They have live bacteria. The most popular one is Align, Algine, and I used a lot of Align, and that seems to work very well. It's less expensive than the ones that you get in the refrigerators. So the global sales of probiotics exceeded $40 billion in 2018. It's estimated to be $64 billion. You go into pavilions or CVS, you're going to see every probiotic on earth. So preliminary work shows that a vegan diet or that Mediterranean diet, a high fiber diet, fermented food like kimchi, kombucha, they are the prebiotics that do have a slightly favorable influence on the composition of the gut bacteria. So I feel that gut microbes are essential. They're not freeloaders. They don't just sit around. They digest your food. They produce anti-inflammatory chemicals and compounds, and they help guide the immune system to distinguish friend from foe. They're very active, these gut bacteria. Let's talk about arthritis, juvenile rheumatoid arthritis, arthritis in children. 300,000 children in the United States get some form of arthritis. We call it JRA, juvenile rheumatoid arthritis. And for some reason, kids who are exposed to antibiotics have a high risk of getting juvenile rheumatoid arthritis. The highest risk is when they take multiple courses of antibiotics. And the risk is not seen with antiviral drugs, such as acyclovir for shingles or antifungal drugs. It's only the antibiotic profile that seems to lead to these kids getting juvenile rheumatoid arthritis. So maybe it's best not to give the children antibiotics. You know, most kids get a sore throat 99% of the time. It's viral, but the patient wants an antibiotic. You know, the doctor has to be tough not to give the antibiotic when the mother's screaming at him. But you could see that children exposed to antibiotics do have a higher risk of getting JRA. And microbes can play games with the mind. Bacteria in our gut seems to decide who gets anxiety and who gets depression. They did a pilot study in 22 men, and there were subtle but definite brain benefits by taking probiotics. And this was reported at the Society of Neuroscience. And different bacteria make neural messages. Like in our brain, we need dopamine, norepinephrine, GABA, serotonin, acetylcholine. And they're all affected by the bacteria in our gut. And that'll perhaps explain why some people get anxiety and some people get depression. So let's summarize. The microbiomes appeared 3.5 billion years ago. They talk to each other. They've been here for billions of years. They affect obesity, which we showed in those patients, cardiovascular disease we showed, neurologic disease, arthritis, necrotizing enterocolitis we didn't get into, but that's also too much antibiotics, diabetes, colon cancer, inflammatory bowel disease, irritable bowel disease, and pregnancy outcomes, and maybe longevity. Next slide, please. So let's close. The composition of the microbiome is changing. It's altered by many, many factors, and there are now therapies directed at the microbiomes, which I mentioned to you, fecal transplantation. So this is a quote from Athelmil Brillian Savalin in 1829. I'm not going to read the French, but he said, "Tell me what you eat, and I will tell you what you are." You imagine 1829. They were already theorizing changes in a human being based on their bacteria. Incredible. So let's go into some questions and answers. We'll unmute you. I'll take a sip of Diet Coke.
Feel free to unmute yourselves if you'd like to answer a question or ask a question.
Did you like it?
Yes.
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 Good.
Fascinating.
Absolutely fascinating. A fascinating subject. I heard this and got interested in this at a GI meeting. A doctor from Harvard, Dr. Gupta. I
What
think
are
he's
you
related
doing?
to the other Dr.
Drinking
Gupta.
Oh,
Oh, am I muted?
No, you're good.
Oh, you're good.
Dr. Gupta gave a lecture on this, and I stole all of his slides because I thought this was so interesting and so fascinating.
I think there's a question. I see a hand up there on Jennifer iPad. If you have a question, Jennifer.
yes. Hi, Dr. Panitch. It's Jennifer Verdon.
Jennifer Verdon, my long-standing patient.
I'm just curious. So the probiotics keep the bacteria in check. Is that sort of a?
I think so. They kind of
Okay.
keep them in check.
Okay, thank you. This
I
is
would
very good.
recommend them. I
Yes.
used to not when I was in practice,
So
but
the
now
ones
the
that
evidence is I'm in favor of probiotics now.
but the ones that you buy at CVS that aren't refrigerated, are they worthwhile, or do those? How could they be?
No, I think a line, ALIGN, is not refrigerated, is worthwhile.
It's a pill.
It's a pill. How
Got
you
it.
been, Jennifer?
Yeah. Okay. Very good. I'm going to see Dr.
Who took
Cohen pretty
over?
soon.
Who took over from me? Who are you going to?
Jerome.
Jerome Cohen.
Yes.
Good man.
So I'm going to see him in September.
I was at the Apple store and another patient sat down next to me and she said, "You don't remember me?" I said, "Wait, I think I do." And she was one of my favorite patients, as you were. And we had a wonderful time reminiscing.
Yeah.
Go ahead.
I'm a lactation consultant, and when I work with moms who have had C-sections, I usually advise them to take a probiotic afterwards because they always give them antibiotics in the hospital. And because they're breastfeeding, does that get carried through to the baby?
Yeah, I think the probiotics will come out in the breast milk, and I think it's good for them.
Okay. I went to a conference a few years ago that the whole 3-day conference was on the biome for the newborn. It was
Really?
very interesting. Yeah, it was in New Mexico, the New Mexico breastfeeding conference, I guess they're called. They did a whole
Wow.
3-day conference on it. It was really good.
Yeah, I would certainly recommend any woman who had a C-section to take probiotics.
Okay.
In the store, they have so many different probiotics. You like the Align, but you know, there are others and they give you 20 billion and 20 million. How do you know which one gives you an adequate amount?
I don't know. I don't know. I'd probably go with the highest number of bacteria.
Okay,
You
and
know,
if it says
that's
live culture,
not too expensive. The ones that are in the refrigerator are very expensive.
yeah.
I think I would take those if I was sick. You know, if I was having diarrhea, abdominal pain, bloating, I think I would give a trial of the expensive probiotics.
I have a question.
Sure.
Oh, okay, sorry. I don't know how to raise my hand on this. So I have been, for about a year now, I've been taking vinegar, you know, organic vinegar in the morning, just a spoonful with water. And I've noticed a big difference in my digestion. But I want to know if this is all in my head or if this is really effective.
Maybe you are changing your microbiome with the vinegar. You're feeling better on it?
Much better.
Yeah, you're probably affecting the bacterial composition of your small bowel.
Okay.
I had a patient who she was 95 years old and she only ate sauerkraut
Oh, yeah.
3 times a day. And then she squeezed it and drank the sauerkraut water in between. I thought at first she was crazy, but at 95 years old, she was walking 2 miles a day. She had no fat on her. And I think that the sauerkraut was a prebiotic and it really helped her.
Yeah. The other thing is I had bariatric surgery about 3 or 4 years ago. So I don't know if that would be part of why this is working on me or not.
Well, your stool in bariatric surgery, like we showed in the lecture, if given to someone, will change their body weight. So bariatric surgery does more than just help you lose weight. It changes your microbiome.
Yeah. All right. Thank you.
We have a couple questions on the chat. Does Diet Coke affect microbiome, and does eating spicy foods affect the microbiome?
I don't think so. I don't think so. There have been no studies on Diet Coke or what was the other?
Eating spicy foods.
I don't think so. I don't think so.
Hi, I have a question.
Sure.
My name is June Pagan. I'm a private health chef for 30 years. My question is today with the pandemic, do you think that the microbiome, that having a healthy microbiome would help in the severity of the course of the virus?
Well, I would think, you know, after vaccination, which we all should do, second would be what you recommended.
You know, changing up the diet, maybe having more probiotics, prebiotics.
More probiotics, Mediterranean diet, high fiber diet.
Yeah.
And
that's what I do for my clients, by the way.
You're doing the right thing.
Yeah. And to mention just one client that I had a few years ago had the fecal implant done, and her sister manages a doctor's office, and the doctor, she was being seen by a team of medical professionals, and one of them suggested the fecal implant, and her sister made the donation, and she had the Whipple procedure with pancreatic cancer.
Wow.
She had the fecal implant after she had the Whipple procedure because she was having a lot of issues. And I think C. difficile was probably one of them. I believe she mentioned that. And so her sister had donated the fecal implant material, and it really helped her for like 6 months.
Right.
She, really improved the quality of her life from that,
Where'd they do it? What hospital?
I don't know. I would say probably Cedars or UCLA.
Is she still alive with her pancreatic cancer?
She is, and I came into the picture after 1 year away from the procedure, and I was just helping her dietarily because she had lost a lot of weight, and her sister was concerned, so they hired me to cook for her. And it wasn't easy because from week to week, she would have a different reaction to the different foods.
Right.
I was doing gluten-free. Yeah. So, 1 week she might be able to tolerate, let's say, a grain, and then the next week not so much. And so it was intermittent, but for the most part, she had gained weight, quite a few pounds, and she felt better. She felt energized. So we're looking now 2 years away, she's not a client anymore, but I think diet can help with the microbiome for sure. So, it's just a matter of eating the right foods, consistently. And then keeping away from, the wrong foods. Like
You must have had a hard time, with the Whipple, and they moved everything around, and they moved the bile ducts around, took out part of the stomach.
Yeah. And she was, I guess, probably mid to late 40s. Yeah.
Well, let's hope one of those new companies come up with these vaccines for cancer of the pancreas. Moderna, who has a vaccine, they're experimenting with cancer vaccines, as is BioNTech, which is the Pfizer vaccine. So they're all using mRNA, which is in these the vaccines, and they're trying to hook on the mRNA to the gene that causes certain cancers. A big breakthrough in the next 5 years.
Yeah, a lot of my work was inspired by Dr. Agus at the Ellison Institute of Transformative Medicine. And he's an oncologist, but he's the head of that institute now. And I think they're doing amazing work in that area for cancer, cancer management. And so my work is primarily the Mediterranean diet, but I have a little bit of an extra accent, which is purple foods, purple plants. That's my handle. So I'm the purple food chef. Purple plants are powerful antioxidants, and they're unique. They're delicious and just different. So
You're on.
I thank you very much for this lecture. I'm enjoying it.
Well, I just want to tell you that this was presented by Torrance Memorial Medical Center.
Yes.
The great hospital, and Torrance Hospital IPA, which I've been a member. I was one of the founding members of that in 1980. And
I read that.
We have 11,000 seniors now in our IPA, and we're really proud of it. We do these interesting things. The next Doc Talk is going to be in a couple of months, being given by
Mhm.
Dr. Dennis, and it's going to be on stress reduction.
Mm,
And
mhm.
that's going to be a good one on, and then I may do advances in gastrointestinal cancer and do CRISPR, gene splitting.
Yes, that gene splitting. Yeah, that's interesting. I would love to hear what you have to say about that.
Yeah, that'll be interesting. So thank
Oh,
you,
okay.
everybody.
Thank
Okay.
you.
I'm gonna run home.
Have a
you.
good week.
Thank you.
Hope you enjoyed it. Hi, Jennifer. Good
Very
to see you.
Bye-bye.
Thank you very
Bye-bye.
much.
Thank
You're
you.
welcome.
Too.
So he's retired. What's he doing?